My name is Cicely Dove, and I am the Vice President of Family Services for Crossroads, Rhode Island, the leading homeless services organization in the state. The mission of Crossroads is to help homeless or at-risk households secure safe, stable housing by engaging in a range of services, including basic needs, shelter, supportive services, education, and employment services. Today, I am joined by Elizabeth Eastland from Los Angeles. We were a part of a discussion among family providers about the challenges facing families with children and various programs trying to meet their needs. Today, we want to talk about how the pandemic is hurting families and identifying ways that communities can better respond by first addressing the families with the highest needs, advancing racial equity, and by getting families housed as quickly as possible. With this video, we are issuing a new call to action, making the case for families and children during the pandemic.
My name is Elizabeth Eastland. I'm the Executive Director of Rainbow Services. Rainbow is committed to providing shelter and support services to anyone impacted by domestic violence, helping them to move beyond trauma and towards safety and stability. Today, we join with national experts leading the work to advance a framework for equitable COVID-19 homelessness response and urge policymakers to include the needs of children and families in the effort to address both the public health and economic crisis created by COVID-19. Too many communities have not tailored their strategies for the unique needs and circumstances of families with children. Too often, families with children are unsheltered, living in cars and tents, and are invisible to policymakers.
In our immediate response to the COVID-19 pandemic, our initial efforts focused on reducing our shelter capacity and adding health and sanitation protocols to comply with the CDC guidelines. We are especially concerned that pregnant women are at increased risk for severe illness from COVID-19, and pregnant women who contract COVID-19 are at increased risk for adverse outcomes, such as preterm birth. Realizing the devastating impact that COVID-19 would have on homeless families, we increased our diversion and rapid resolution housing strategies with the ultimate goal of minimizing the risk to the vulnerable population. Diversion is a critical component of the homelessness crisis response system and is proven to be highly effective at reducing the number of households entering into the homeless system. However, we continue to see an increase of households whose financial and social safety nets have disappeared as a result of the pandemic and who now find themselves at risk of homelessness. Over the past 4 months, our family statewide shelter prioritization list has increased 120%, with signs that it's likely going to continue without direct intervention and support. Through diversion and rapid resolution efforts with flexible assistance, we continue to work with families to get them stabilized in safe, permanent housing where they can take the necessary precautions to keep them and their families safe.
At Rainbow, we began receiving an increased number of calls on our hotline requesting shelter, and we're one of the first organizations to participate in Project Safe Haven, placing survivors and their children in hotels as Los Angeles shelters began to reduce their capacity to accommodate social distancing protocols. COVID-related job losses are widening gender and racial disparities, especially for single female heads of household. Similarly, gender and racial disparities occur in who is evicted, with single Black female heads of household experiencing very high rates of eviction. These same families were already at greatest risk of homelessness and experienced homelessness more frequently.
Our agency is seeing firsthand that families are struggling not only with the homelessness, but also with the loss of access to full-time childcare and in-person school. This is negatively impacting children's social and cognitive development and parents' ability to maintain employment and find housing. We are making a big push to support online education with the appropriate technology, internet access, and individual spaces to support remote learning within the shelter. When our schools went fully remote in March, most of the children didn't have the proper computers to engage in this new learning platform. There were already overwhelming concerns from the families on how they would make the adjustment to this new style of learning, let alone the fear of not having the adequate technology to participate. We worked closely with the local school departments to address the technology deficits of the children in shelters, and they were able to provide them with computers, mobile hotspots, and technical assistance to the families navigating this new online platform. With more children in shelter during the day, we've also had to ramp up the meals that we serve. We are also trying to fill the voids that were created when community-based services were cut or moved to telehealth or virtual models. It is very challenging, and more resources are needed as this pandemic continues to drag on.
I share the concern of many experts that domestic violence and interpersonal violence has been increasing during the pandemic, and that victims have fewer options if they wish to escape their situation. I'm concerned that despite reduced reporting, there are likely increases in child abuse and neglect. In Los Angeles, we were fortunate to identify funding for Project Safe Haven to provide additional shelter beds to those wishing to flee their abusive situations. We quickly mobilized to have weekly calls among city and county departments, along with service providers, to ensure our efforts to address domestic violence were coordinated. This included the district attorney's office, the city attorney's office, the Los Angeles Police Department, and the county sheriff's department to ensure law enforcement officers were offering the expanded 30-day restraining order to victims.
As we wrap up today, we want to emphasize the importance of including families with lived experience of homelessness in creating plans, setting policies, and monitoring progress. A recent series of briefs by the National Innovation Services as a part of the framework noted that services must be designed that understand, respect, and address the historical and current barriers caused by systemic inequality connected to their various identities.
I absolutely agree with you, Cicely. I really hope that with wide range of new funding sources, including CARES Act programs, funds are strategically used for key public health and economic recovery to meet public health goals, increasing housing stability, and prevent future increases in homelessness, all with a racial justice and equity lens.